unity forever, for the union makes us strong.
Afya power.
Power.
Solidarity.
Forever.
So, my fellow unionists and the members of the further states, my name is Washira Peterson. I am the National Chair for Kenya Union of Clinical Officers. I am also the Chair for Health Union Caucus that brings together the unions that represent health workers, together with also the Kenya Health Professional Society that represents those who are not unionized. So I'm here with a representative from the different unions that we have in the health sector, from Canaan for nurses to CUNAD for nutritionists, and all the unions representing the health sector. So we came to Nakuru because of the outcry that we have been hearing, not only from our healthcare workers who have been terminated unfairly, but also to the public who are suffering from the shortage emanating from lack of services that these officers were providing. We had an opportunity to visit the outpatient and the inpatient in the Nakuru Level 5 hospital, known as the PGH. And I can tell you the situation there is chaotic, because the clinic officers who are there previously have been terminated, and those who were being engaged in a very funny manner, they even refused to report. The things we have found here are really worrying. And I must say that as a country, we must be serious about what we want to do with our health and the direction we want to take in terms of healthcare. The issue of contracts that we have seen here, we have seen that the people standing behind me, employed or engaged since 2019 on short-term contracts under 6 months, which is against the law, for 4 years. They have never been given any gratuity. Nobody can be allowed to go and further their education. They did not qualify for any pension. There is no way of that person being able to develop themselves and being engaged like casual workers. And we are talking about the health sector. And this cuts across all the cadres from the doctor to the mortician. And it's very unfortunate. And the most unfortunate being that the governor, Nakuru County, Governor Kihika, we supported her as the health sector because when she was coming in, she actually promised that she was going to ensure that she harmonizes the terms and that all health workers would actually be on permanent and pensionable. We are seeing even those who are now being replaced. And by the way, you know, we are being told that the reason as to why they disengaged the officers who we are here today with, who are under contract, is because they wanted to abide by the law and ensure that they harmonize process and bring in the sanity. But those people who have been sent to replace them, there has been no advert. There has been no interview. They were simply disengaged. And people are appearing in hospitals that they have been engaged. They don't even have any paper to go and work there. We actually do not even know if they are officers, as we are being told, if they are qualified officers who are supposed to be working there. And we cannot be propagating the same thing that we are saying that we are trying to cure. As unions, our stand still remains that any contract, whether hospital-based, whether county-based, is irregular. Contracts in this country are guided by Public Service Commission Act of 2017, and it provides very clearly that the only time you engage a civil servant, because this is civil service, this is not the private sector, the only time you are going to engage a professional on a term of contract is when the service that they are going to render has an expiry date, has a time frame, or is an emergency, or it's an expertise that has not been there. So you can engage on a contract so that they can be able to serve more than one areas. Because on PNP, of course, you cannot be able to do that. Now, they're engaging people even on short-term contracts against the provision of the PSC and the regulations emanating therefrom, and the framework that they are telling us they are following, in fact, provides very clearly that you cannot be able to engage anybody on a short-term contract unless it's either an emergency or an expertise that is not there. And says we must abide by Section 45 of the Public Service Commission Act, which provides that if it's not a service with a time frame, and if that officer does not qualify for any other, that is the only time we are going to engage them on contract. So all the contracts being given, the ones that were there and the ones that the county government of Nakuru is giving today, are both irregular and illegal. And we have made that fact clear. The other thing is that the officers you are seeing here, while they were terminated, a number were brought back and the others were left. But the county is not able to explain why they decided to pick person A and leave person B. There is no criteria. We have inquired whether there were disciplinary issues with the people who have been terminated, and we have been told there was none. And so you wonder how people were brought in. But we know how people are brought in. It is on political basis. We know politicians have been sourcing for names, and those people are the people who have been put there to replace the others. And we cannot run health sector in this manner. That is why we have been saying we need to depoliticize the health sector. And that is why at some point we are saying if we can be able to get a commission that respects devolution, that will be able to survive in the setting of the devolution, probably that would be the solution. Because County A is doing this, County B is doing the other one, and now you can see the results. My brothers and sisters here who are aggrieved are being subjected to unfair labor relations simply because of politicization of the health sector, where people come in with their interests, they want to serve their interests, and they do not put the interests of the common mwananchi from Nakuru County before their own interest. So we have made our stand clear that unless you can tell us the criteria on how you have been able to delineate who you are going to retain and who you are going to dismiss, then that is discrimination as per Article 27 of the Constitution. Because our Constitution provides that nobody should be discriminated under any grounds. And if you cannot tell the criteria used to retain some, then it means you are discriminating them, you are subjecting them to unfair process, and that is well also provided under the law. So I was sent here by the other unions to come and do a fact-finding as we meet the county officials, and we have that information. And our role is to ensure that our members who we are with here today are not subjected to unfair labor relations. So as the unions, number one, we will be writing to the governor demanding that everybody who was there is first reinstated, and number two, absorbed on PNP because they have already been subjected to unfair labor relations in terms of being given contracts that are illegal, working for a long time under oppressive terms of engagement, and the fact that even when they were there was still a dire shortage of health workers. You can imagine, like, if we talk of PGH here, the hospital contracted, the ones they call cashews, are actually more than those who are employed on permanent and pensionable. So you are being seen by people who are anxious on what is going to happen tomorrow. Well, they have a shortage, and you can imagine that confusion when you have a shortage. So you have fatigue, and then you have anxiety because you don't know if tomorrow you'll be told not to report back to work because you are basically a casual laborer. We are treating medics as if they are casuals, and what that means is that going forward, if we continue with these short-term contracts, we will not be able to take people back to become specialists. I can assure you, if this issue of contracts is going to take root, in 10 to 20 years, when the consultants that you know are going to retire, you will go to Tanzania or to Uganda to get a gynecologist, to get a surgeon, because there is no county that is going to take somebody back to specialize when your contract is 3 years, and your specialty requires more than 3 years for you to be able to specialize. So we must be able to strategize as a nation on where we want to go to. I think our president, under the plan, had provided very well that we did the universal health coverage, which simply means health is brought nearer to where you are. And he now said that I want to move from universal health coverage to universal health care, which means now we don't just want to know that health services are near you, we also want to know the quality of those services that are near you. There is no way you are going to get these quality services if you are not going to have people who are going to stay at work for many years, gain experience and specialize so that they can be able to be better in their trade. And that is what is now happening. So let me say that it's very unfortunate what is happening here. And I can say without doubt that these workers have been subjected to unfair termination in the context of Employment Act, the Labor Relation, and even the Public Service Commission Act, and that even the contracts that are being given are irregular. And as the unions, we are going to take all the necessary measures to ensure that our members enjoy their rights, and we are not going to spare anything. Lastly, before I invite my colleagues to also give their remarks, let me say that we have an outstanding nationwide strike that is going to begin on the midnight of the 13th of this month. We had given the counties and the Ministry of Health 60 days from 15th of May so that they can come to the table and we can agree on the matters of the collective bargaining agreement, including the contracts that we are talking about. For all that time, we have not seen any engagement. They have not even responded to our letters. So I want to tell Kenyans that it's unfortunate. We as the unions, we had the goodwill. We gave the 60 days so that we could go on the table and we couldn't interrupt the services. But the government seems not to care about the citizens. They don't care whether you're going to get the service or not. And they have decided we can go on strike, and I can assure them we know how to do it. And come 13th midnight, across the country, in all the facilities, there is no healthcare worker who is going to be there unless some magic happens and within the 7 days, we complete the CBS that we have and register. By 13th midnight, Kenyans will not be able to access the services because simply the government has decided to go on strike.